Hello, I am Dr. Koushik Dutta, Neurologist at AMRI Hospitals, Dhakuria. We observe the World Stroke Day on 29th of October to build awareness about stroke, its consequences, and its treatment. Our focus is on ischemic stroke particularly. Strokes, including ischemic strokes, can have devastating consequences if not treated very early. These strokes can render a person paralyzed, unable to speak, and even bedridden for a very long time, sometimes for life. But nowadays, strokes, particularly ischemic strokes, are highly treatable. But they have to be treated very early. And why so early? Because you are losing 19 lakhs, 1.9 millions of neurons every minute after the stroke onset. So you understand that our slogan here is time is brain. If you lose time, you lose your brain, and if you save time, you can save your brain. So what is the easiest form of treatment that we have that can be done very early? If you just bring the patient to a stroke ready hospital very early, we just need a CT scan, and once we confirm that this is an ischemic stroke, we can do an IV thrombolysis with a simple injection if you are a suitable candidate. After running a few checks on you, only a CT scan and a blood glucose is sufficient. No other costly investigations are needed to do this IV thrombolysis. And if done early and if you're a suitable candidate, this IV thrombolysis can have wonderful results. Some of you will be able to walk back home. In others also, the amount of damage caused by the stroke can be brought down. But remember, time is brain and you have to save time. This has to be done very early. We cannot do this after 4.5 hours because that is the window period. So if we lose time, you lose the opportunity of treatment, and then the consequences can be very bad. So be aware of ischemic strokes and rush to the nearest hospital whenever you find that a person is having weakness in one of the limbs or is unable to speak properly. So this is FAST, FAST. If there is a facial deviation, F for face, A for the arm is weak, the face is deviated to one side, and the patient is not being able to speak properly, S for speech, then it's time to rush to your hospital. Thank you all.